Good morning everyone. I am Dr. Prasanna Jaiprakash Gore, Consultant Gastroenterologist at Renova Sanath Nagar Hospital, Hyderabad. So today we are going to discuss about a topic called as gastroesophageal reflux disease. Why are we discussing about gastroesophageal reflux disease? Nowadays, due to the changing lifestyle and stress, we see a lot of cases of gastroesophageal reflux disease. And I see many queries and many patients who ask me about why do we have gastroesophageal reflux disease, what are the symptoms and how can we prevent it. So today I am going to tell you in short about what are the symptoms, how can we diagnose GERD and how can we treat the symptoms of GERD. So let me first tell you the anatomy of the stomach. So stomach, as you know, in GI tract is a organ which helps in digestion. So acid secretion occurs in the stomach and ideally the acid should be in the stomach only. It should not go back from the lower esophageal sphincter to the food pipe, which is the esophagus. In some conditions, what happens is the lower esophageal sphincter, which is the sphincter or a valve between the esophagus and stomach, becomes weak. So when it becomes weak, what happens is the acid comes up in the food pipe and it causes ulcers here. And it causes symptoms like pain and heartburn or burping or bloating symptoms. The normal, which I had explained you, the normal thing is the acid comes up and goes here. The valve is closed, and when you see that in GERD the valve is open, the acid goes up and it causes ulcers and burning sensation. So what are the symptoms? You can see the symptoms of heartburn, that is the burning sensation in the chest, or pain while swallowing, chest pain which can mimic heart attack as well, or nausea, and return of food contents, whatever you eat that comes up into the throat, or the acid which comes up into the throat or the esophagus. So common causes of GERD are obesity, especially the central obesity, which is commonly seen in Asian people, and smoking, alcohol, caffeinated or carbonated drinks, fatty food. So how do we prevent this? So for the prevention of GERD, we have to follow few steps. First thing is, after eating food, you should not lie down for 2 hours. Second thing is, after eating food, you should not drink water for at least 1 hour. Third thing is, whatever your appetite may be, you should eat 50% of your appetite. So say if your appetite is of 4 chapatis, you should be eating 2 chapatis, so that the reflux will not occur. And fifth thing is that walk 1 hour in the morning and 1 hour in the evening should be there. And typically few things are triggered like citrus fruits, milk and milk products, caffeinated, carbonated drinks, alcohol, smoking. So you should avoid such things. If the rare complications of reflux disease are ulcers, strictures, some patients may have, so what happens is in the long run, patient may have ulcers and then the stricture, which is the stenosis of the GI tract, and later on it can turn pre-malignant, which is called as Barrett's esophagus, and later on esophageal cancers as well. The atypical symptoms can be cough, asthma, change in voice, sore throat and difficulty swallowing as well. So if you have such symptoms, please do visit a nearest gastroenterologist and get an endoscopy done to detect GERD. Thank you.